Welcome to Med Madness, where we delve into crucial medical topics to enhance your knowledge and clinical skills. Today, we're discussing aortic stenosis, a condition that every medical student needs to understand thoroughly. This episode will help you grasp the essentials of aortic stenosis, from its causes and symptoms to diagnosis and treatment. We'll also walk through a real-world case study to bring these concepts to life. So, let's get started. Aortic stenosis is a condition characterized by the narrowing of the aortic valve opening, restricting blood flow from the left ventricle to the aorta and the rest of the body. It's crucial to understand this condition because it can lead to serious complications, including heart failure and sudden cardiac death. The most common causes of aortic stenosis include age-related calcification of a normal aortic valve, typically seen in patients over 70, calcification of a congenital bicuspid valve, often presenting in younger patients, and rheumatic heart disease, which remains common globally but is rare in resource-rich countries. The pathophysiology of aortic stenosis involves the progressive calcification and thickening of the aortic valve leaflets. This calcification process is similar to atherosclerosis, leading to reduced valve opening and increased left ventricular pressure. Over time, this pressure overload results in concentric left ventricular hypertrophy and can cause significant cardiovascular complications. Next, let's discuss the symptoms and clinical presentation of aortic stenosis. Patients with aortic stenosis often remain asymptomatic for many years. However, as the condition progresses, they may develop symptoms such as dyspnea on exertion, decreased exercise tolerance, exertional angina, syncope or pre-syncope, and signs of decompensated heart failure. On physical examination, you may notice a crescendo-decrescendo systolic murmur at the right upper sternal border, radiating to the carotids, and possibly an S4 heart sound. Diminished and delayed carotid pulses, known as pulsus parvus et tardus, are also characteristic findings. Moving on, let's outline the diagnostic methods and tools used to identify aortic stenosis. Diagnosing aortic stenosis involves a combination of clinical evaluation and diagnostic tests. Key diagnostic tools include transthoracic echocardiography, which is the primary imaging modality to confirm the diagnosis, assess the severity of stenosis, and evaluate left ventricular size and function. An electrocardiogram may show signs of left ventricular hypertrophy. A chest X-ray can reveal cardiomegaly or aortic valve calcification. Cardiac catheterization is used in certain cases to measure hemodynamic parameters and assess coronary artery disease. Now let's describe the treatment options available for aortic stenosis and potential complications. The management of aortic stenosis depends on the severity of the condition and the presence of symptoms. The mainstay of treatment for symptomatic severe aortic stenosis is surgical valve replacement. Options include surgical aortic valve replacement, or SAVR, which is traditional open heart surgery to replace the aortic valve, and transcatheter aortic valve replacement, or TAVR, a less invasive procedure suitable for patients who are high-risk surgical candidates. Medical therapy is limited in managing severe aortic stenosis, but it can be used to manage symptoms and comorbid conditions. Lifestyle modifications, such as maintaining a healthy weight, avoiding smoking, and managing blood pressure, are essential preventive measures. Let's consider a case study to illustrate aortic stenosis in a real-world context. A 68-year-old male presents with progressive exertional dyspnea and a late-peaking systolic murmur, best heard at the right upper sternal border, radiating to the carotid arteries. On examination, he has delayed carotid pulses and an S4 heart sound. Transthoracic echocardiography confirms severe aortic stenosis with a valve area of less than 1 square centimetre. The patient undergoes transcatheter aortic valve replacement, or TAVR, leading to significant improvement in symptoms and exercise tolerance. In summary, aortic stenosis is a critical condition that requires timely diagnosis and management. Understanding its causes, symptoms, and treatment options is essential for providing optimal patient care. Early diagnosis and intervention can significantly improve outcomes and quality of life for patients. Thank you for tuning in to Med Madness. Don't forget to engage with our pre- and post-podcast quizzes and Anki flashcards to reinforce your learning. Stay curious and keep pushing the boundaries of your medical knowledge. Until next time, this is Med Madness, signing off. Remember, together we can change the medical education system.